You're listening to the Veterans Impact Show, continuing the mission of service and bringing together our civilian and military communities. Brought to you by Fairway Independent Mortgage and Lone Star Wealth Strategies. Don't worry, retire happy and work with us. What a great day. All the bad weather's over. It's absolutely gorgeous. Joining me, my number one best buddy, Chuck Wright, Marine Corps pilot, financial advisor, great veteran, Texas Veterans Commission, Benefits Board. Man, your resume is wonderful, Chuck. Thank you for being part of this for so long.
Absolutely. This is a lot of fun. And to those joining us, you might notice a little bit of difference in the screen today. We are finally joining the 21st century. We're coming to you on StreamYard. We had this conversation last week, and our main man, Nathaniel Smith of Ascend Podcasts, but a full service media firm who is producing our show, has really taken us into the 21st century, but we're going back to the 20th century. You will notice that Jim and I are sitting in the ready room
on the USS Midway from San Diego.
This is exactly the picture from the USS Midway, a boat that I've actually landed on.
All right. And this program today is all about medicine and aviation. I want to introduce to you a very good friend of mine, very dear friend of mine, quite frankly, because he is my doctor and he is an FAA medical examiner, Dr. George Cole. Dr. Cole, welcome aboard.
Thank you. It's an honor to be here.
Hey, listen, I got to tell you, it's an honor. I didn't know when I was sent to you and I needed an FAA examiner, I didn't know all of the things you did. And I look back and I go, gosh, if I'd have known about some of these things that you were doing, I might not have had the heart attack. I might not have had some of the issues. So part of this is about preventive medicine. Part of this is about innovative medicine and all you do. But Dr. Cole, could you go back and tell us a little bit about your military history? You served in the Air Force and you served in the Army as well. Can you tell us a little bit about that?
When I graduated from college, I had the good fortune to run into an Air Force recruiter one day, and I decided that sounded like a good idea. So I signed up to go to the Air Force. I went to officer training school in San Antonio in the summertime. And back in those days, they didn't have any air conditioning. It was pretty hot in July and August. But I finished officer training school and went to Mississippi to Keesler Air Force Base for 1 year of training in electronics, which was a little different from me, who had been in music all my life. But I was then assigned to Topsham Air Force Station in Maine as an electronic countermeasures training officer. And we were a division headquarters for NORAD, North American Air Defense Command. We actually had a Canadian commander, a one-star general from Canada. I spent 3 years in Maine training officers and people running radar sites. We had five radar sites and five fighter squadrons that were in 26th Air Division. So that's how I spent that time. Then I did a few other things in the meantime, and then was very fortunate to be able to go to medical school, which had always been in the back of my mind. And during my medical school, they started scholarships for the armed forces. And I signed up for the Army because the Air Force had some hospitals way in North Country that I didn't want to go to, in Greenland and Iceland and Alaska and some places I didn't want to go to. So I signed up for the Army. And so after I finished my residency in orthopedic surgery, I spent 2 years at Fort Sill in Oklahoma in the Army doing orthopedic surgery in the Army.
Wow. Orthopedic surgery. I mean, that is so important. And that's basically, you're talking about helping people who've also been injured, correct?
Well, one of the most interesting, we didn't have war casualties that I remember. We had a dentist that went out to the firing range, the practice firing range, and picked up something he shouldn't picked up, and it almost blew his leg off. That was one of my most interesting cases. But he got well. Wow. We took care of it.
Now, did you fly any while you were in the Air Force, or are you strictly an avionics officer?
No, I flew backseat. We had old T-33 jet trainers that we had 3 of those, and we had Royal Canadian Air Force pilots that were on liaison down to our NORAD command center. And these guys just wanted to fly. And I worked for a colonel who liked what I was doing. And so anytime I wanted to go somewhere, he gave me a T-33 and a Canadian pilot, and we flew. So I flew backseat in a T-33 for probably 40 or 50 hours, quite a bit.
Oh, wow. That's great. I got to tell you, you are a licensed pilot. And as I mentioned, you're an FAA flight examiner. So
That's
if a
correct.
young man or young woman wants to get their Class 3 medical certificate or their medical certificate or an airline pilot, you're the guy to go to, correct?
That is correct. We do everything right up to first class. I did several, even though it was icy in Dallas this week, yesterday, I did several first class airline pilots.
I got to tell you, one of the big things that I noticed or I saw was you do therapies that are very, very advanced and very different. Can we get started and talk a little bit about your chelation therapy? What is that?
Yeah, we're talking about treatment therapy.
Yeah, treatment therapy.
Say the whole thing.
Okay.
We got to coax him along a little bit sometimes, Dr. Cole.
Chelation therapy was developed probably 50 years ago as a method to help clean out the arteries in people with cardiovascular disease. One of the originators was a doctor named Elmer Cranton, who wrote several books, very, very good books about chelation therapy. It flew under the radar for a long time because sometimes organized medicine didn't support alternative treatments. They really wanted to do a lot of testing and surgeries. And the National Institute of Health, our federal research branch, completed a study on normal protocols for chelation therapy. It was completed 6 or 7 years ago. And the NIH study showed conclusively, number one, that chelation works. Everybody in the study, all the patients in the study, and this was tens of thousands of people. This was a big NIH peer-reviewed research study. Everybody in the study, their 5-year death rate was down 20%. So it worked for everybody. For diabetics, it was down, their 5-year death rate was down 40%. The reason, in my opinion, again, I'm not an immunologist, I'm not a research scientist, but I believe in the big research, peer-reviewed research. And the reason diabetes causes problems in people, one of the reasons, is it causes severe inflammation inside the arteries that causes the blockage, that causes the problems diabetics have. Their circulation goes bad, and that's the reason they lose the nerves in their legs, their lower extremities. They get what's called diabetic neuropathy, and they have terrible pain. And sometimes they have amputations. Their kidneys go bad, their hearts go bad, their brains go bad, their eyes go bad. But the reason, one of the reasons that diabetes causes the problems is because it causes severe inflammation inside the arteries. The NIH study showed that the reason IV chelation works is because it reduces the inflammation inside the arteries that causes all these problems. So IV chelation works for everyone. It works especially well for diabetics. The way it works is by binding with heavy metals and free radicals in the body and takes them out through the kidneys, and thereby reducing the inflammation that causes serious cardiovascular problems.
So, Dr. Cole, we got a quick question for you, and I'm going to try to, oops, oh yeah, don't take that away. I'm not sure I can pronounce these two words, but we've got one of our listeners asking how this would work for somebody with ankylosing
spondylitis.
Oh my Lord. So would this help somebody like that?
It's a degenerative condition of the spine that's, and again, I'm not an expert in this kind of thing, but it's predominantly an inherited sort of thing, almost a genetic thing that's passed down from generation to generation. But it's a deterioration between the bones in the spine. It's very painful. Sometimes it can produce different kinds of curvatures in the spine. But the big thing is it's painful. I'm not going to tell you that chelation is going to cure ankylosing spondylitis. I have heard stories from all kinds of stories from all of our patients. And many of them say that their arthritis is better. because, again, it reduces inflammation.
I think that's amazing. Let's go back to the diabetes, because I was talking with the director of the North Texas VA one time, and I said, "Gosh, I hate to go to the VA here in Dallas on Lancaster because there's all these combat veterans in wheelchairs with amputations." And he looked at me and he said, "Jim, those are not combat; those are diabetics." And once the diabetes really sets in, you start getting the ulcers, and the only way they can cure them, because it's gangrene, is by amputation. And he said, once you amputate a toe, then you have to amputate a foot down the road, then you have to amputate below the knee. And he said, it's just a progressive going up the body. And he said, it's a horrible thing. And what you're talking about would do so much. You say 40% reduction. That would also tremendously reduce the amount of required these amputations. Like gangrene is an inflammation. So this would be a phenomenal thing to treat that, correct?
Yes, sir, it is. We treat a lot of diabetics, and they come in usually the first time because they've had some kind of infection. Fortunately, it usually hasn't gone to gangrene, but they have some kind of a breakdown in the skin because the circulation has gone bad, and somehow they heard about chelation. They come in and they do very well.
And chelation, can you explain what is in the injection you take? What it I know you use you have a saline bag, but you have this in it. Can you explain a little bit about that?
Yes, sir. Let me back up a little bit. If you just type chelation into your browser, the first thing you'll get is 5,000 pages of stuff people made in their garage, that are their oral preparations and all of other things. And the ones that have been researched, that have really been scientifically studied, will admit they only absorb 5%. Well, that's not the problem. If I could take a pill every day, I could catch up at 5% a day. That's not the problem. It's the 90 in oral chelation. The problem is the 95% that does not absorb goes through your intestinal system and chelates out the good stuff you're putting through your system. That's the problem with oral chelation. All the recognized studies, all the recommendations from all the recognized research studies show that it has to be done IV. Now, in the IV bag, ethylene diamine tetraacetic acid is EDTA. That's the medicine that's in chelation. That's what does the effective treatment to reduce the inflammation inside the arteries. We use 3 grams of EDTA in our chelation bag. We also use 5 grams of vitamin C as an IV infusion. That stimulates the immune system in the body, and the most effective thing you have in your body to combat anything that comes in is your own immune system. Well, vitamin C stimulates that immune system. It also stabilizes the cells in the lining of the arteries. So you clean out the inflammation, you stabilize the cells in the lining of the arteries with the EDTA and the vitamin C. We also use a B complex infusion, and we also use magnesium as a buffering source.
Good heavens. This has been around. When I looked it up, this has been around since World War II. The British developed it. So
the way it started was frankly serendipitous. The Navy used EDTA to clean out the calcium in the boilers in the ships in World War II. In the 1950s, doctors thought, I wonder if that would work in people. And so they found a pharmaceutical product that they could use to try that out. So that's how it actually started.
Wouldn't you know, a sailor came up and said, gee, if we can clean out a boiler, we can clean out a sailor. That somehow or another, that just gets. All right, we're going to take a break to hear from all of our sponsors and people. Thank you for being on board with us. And if you're in South Texas, thank you for being part of the No Bull Network. And if you're in California, thank you for being with AUN. Also, we've got to say that because Fairway sponsors this, my NMLS number is 311548, and our corporate one is 2189. I am part of Fairway Independent Mortgage. I'm a specialist in senior lending, and we'll talk about what Chuck does when we come back. This is the Veterans Impact Show. Welcome back to the Veterans Impact Show, and thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Well, I'm Jim Blythe, U.S. Navy veteran and a patient of Dr. George Cole, and I've brought my best buddy here who has been with me since we started this way back when, Chuck Wright. And my wife, Diane, and Nathaniel, and we are so glad that you're listening in today because we're talking about great innovative medicine. Why do I want to talk about this? Because I'm participating in it. And I'd like for you to meet Dr. George Cole Wellness Center here in Dallas. You can go to his website. We're going to put that up. We want you to know about this because this is a very, very innovative and effective in many, many ways. So, Dr. Cole, we've been talking about the chelation and what all that does, and especially diabetics. And I happen to know a diabetic who is an Air Force bird colonel and a doctor who might want to come talk to you as well. In doing that, you also talked about the vitamin C. Now, we talked about the vitamin C infusion along with the B17 for me because I have very, very early stages of prostate cancer. And by the way, every man who you live long enough, you'll get prostate cancer from everything I've ever read. Can you tell us a little bit about that and some of the stories? Because I know you've been treating people for cancer with this therapy for some time.
B17 is a product that a patient brought to me, to be perfectly honest. And let me back this up to start with. I'm never going to tell anybody that anything we do is going to cure cancer. I hope that what we do will help with all the other things that you do to treat cancer. But I'm never going to tell you that it's going to cure cancer. However, about 6 or 7 years ago, a man brought his wife in. He literally carried her in. A little Middle Eastern lady. She couldn't have weighed 80 pounds. She had metastatic cancer. And she said, "Would you please give me B17? Jim, I didn't have the slightest idea what that was. So she brought me the information on it. And I started looking at it. And again, I want to preface this. I'm not an expert. I'm not a research scientist. And I'm not going to tell you this is going to cure anything. But she brought me the information. And I said, if you think this will help you, I will be glad to help you. Texas is a good place to practice alternative medicine because as far as the medical board is concerned, if a patient understands that what they've asked you to do is not necessarily the only way to treat it, that there are many other ways to treat whatever malady they have, including cancer, and that this is perhaps a secondary way, if they understand that, then, and they sign a permit acknowledging that they understand that, then it's okay. And we have a special permit for B17 to acknowledge what I've just said. B17 is amygdalin. It's apricot. It's processed from apricot pits. It started, 50 or 60 years ago in Mexico with treatment centers down there, and it probably wasn't very good. It probably had some toxic elements in it. People probably had some bad reactions to it. And so amygdalin got a very bad reputation. This product now is produced in pharmaceutical type laboratories. And the way we do it is the patients order it themselves and they bring it to me. And we then will infuse it, again, with the proper permit signed ahead of time in our medical clinic, along with the other things that Jim has talked about. This lady, that her husband literally carried her in the first time, after about a year of treating with B17, she was bouncing around our clinic telling everybody how healthy she was and how wonderful everything was. And she had gained weight and she was healthy and everything was good. And that went on, and she told a lot of people about it. We had other patients start treatments with it. That went on for 4 or 5 years. And then she finally did fail. And she's not with us anymore. But she had a very, very good result for several years when she came to us the first time in extremis. We now have several other patients who are treating exactly the way I've told you. They bring it in, they order it and bring it to me. We have a very successful entrepreneur who owns a very successful pharmacy in Dallas who treats with us with B17. We have some other patients also. So That's the way we do it. And I'm not a cancer specialist. I'm not a research scientist, but that's how we do it. And we have had several very good results with it.
Well, I'm one going through that right now, and fortunately, we caught prostate cancer very, very early, and so we're working on that. So when we come back from this break to hear from all of our supporters, we want to talk more about these in alternative medicine. And I am so thankful for what Cole Wellness Center does for me and for my family. And I want everybody to know about it. So go to our Facebook page. We're going to be posting this for Dr. Cole. We want you to know more. And all of those folks that are listening in, watching this, we're getting all of these things posted. Thank you for being on board with the Veterans Impact Show. Welcome back to the Veterans Impact Show, and thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Well, I got to tell you, Marine, this is a great thing because I know a lot of Marines and sailors who have diabetes, and I've seen it. And I think one of the things, and Dr. Cole's talking about, is getting rid of the inflammation. That's also, I would think, Dr. Cole, one of the things that could be a preventative if you have a family history of heart problems, and I have that as well. And so the chelation really is effective in those areas and been around for 50, 60, 70 years. You're talking about, though, the B17, and you combine the B17 with a vitamin C infusion. Can you tell us a little bit about that?
And we're not talking about the Flying Fortress either.
No.
The reason it's combined is the way we treat this is the B17 is specifically used to treat the cancer, whatever the cancer is. And to be perfectly honest, I don't know the physiological basis for the metabolic basis for that. I don't know anything about how it works. I just see the results, and people have done very, very well. The reason we use the high dose vitamin C along with that is because it does. It's research proven to stimulate the immune system. And so if you treat the underlying problem, the cancer, and you also stimulate your own immune system, you're doing a double-barreled approach to treating the problem that you have. The vitamin C, we start, as I said, the usual EDTA chelation has 5 grams of vitamin C. We have patients that do 50 grams of vitamin C because that heavily stimulates the immune system. And we have to build up to that. You don't start with 50 grams, but one of the originators of vitamin C was Dr. Linus Pauling, a Nobel Prize winner back in the 1950s or 60s. And he was not a physician. I think he was a physicist. I'm not even sure about that. But Dr. Pauling, back in the 50s and 60s, would take 30 grams of vitamin C every day. And I don't know whether that's a good idea or not. But to treat these kinds of things, to heavily stimulate the immune system, we treat with we build up to it, but up to 50 grams of vitamin C.
So I want to jump in. Jim said something, and I almost went to a joke because he was talking about your treatments for him for prostate cancer, and I was going to go to the standard male macho, wow, way too much information. And it dawned on me, that is one of the problems that we have, is that we have too few men who are willing to discuss. To quote Tom Arnold from the great movie True Lies, he looked at Arnie and said, "You got to get in touch with your feminine side." And it was funny, but it's true. We need to start talking about this more. We need more preventative, and men need to be more aware of this because prostate cancer is one of the most preventable and fixable, for lack of a better word. Hey, I'm a Marine. I write in crayons. Don't hold me accountable for all the big words. Most of this show has gone over my head. Other than the basic concepts, there are ways of treating this that are a little bit more, am I saying this right? A little bit more natural, a little bit less invasive, but are producing, and I've learned so much about inflammation, and unfortunately I'm dealing with type 2 diabetes, so I guess I gotta check myself in. And yes, Lisa, Semper Fi. But I kind of wanted to inject that public service announcement there. Guys, we need to be paying attention to this stuff.
Absolutely, because here's one of the things. Pardon me. One of the things that we realize, for instance, prostate cancer, very, very, very slow. Also, many people say, well, maybe it's not a form of cancer, this, that, and whatever. But then people die from it. Any number of things. But if it metastasizes, you got a bigger problem that's going down the road. Now, again, we were talking about diabetes with Dr. Cole and what that can do. I've seen what that can do because people end up with amputations, and everybody I've ever known who went all that far and started into that process of the amputations ends up dying within a very short period of time. So we're talking about therapies that don't necessarily cure, but put it into remission, put it into saying, let your body immune system. These are alternative. And I know one of the things, and I'm going to step out on a limb here. The typical cancer treatments kill people. The typical cancer treatments that have to do with chemotherapy and surgery and radiation and all of that, the side effects are horrible. And we watch people die. I watched my mother die. I watched friends die. And so if this can give you a quality of life, if this can stimulate your immune system, this can work. So one of the things you should be doing is make an appointment with Dr. Cole and go in and say, hey, Dr. Cole, I'm just fine, but I've got a history of diabetes in my family. I've got a history of heart in my family. What can you do to help me? And this becomes a preventative thing so that you don't. Now, if you're a pilot, let me tell you, I lost my medical because I had a heart attack. I think if I had been doing the chelation, I probably would not have had a heart attack because it opens up the blockage. So, you know, I fought like hell to get my pilot's medical back, and I'm good.
So you're saying the sailors could have fixed your problems by cleaning out your boilers?
Something like that. Yeah. Dr. Cole may not appreciate that one, but let's go back. I want to also give out Cole Wellness Center. The number is 972-851-0111. So that's 972-851-0111. Go to the Cole Wellness Center website. We've got that posted. Take a look at it. It's on Trinity Mills, just west of the Dallas North Tollway. It is in the city of Dallas, but it's pretty close to Plano, North Dallas. And it's it's very, very reasonable, very reasonable. And when you take a look at what I'm doing with the vitamin C infusion. Now, Dr. Cole, let's go back because the vitamin C infusion and the B17, you do it as an infusion. So could you explain that to people who may not know much about what that is?
That means it's an IV. It has to go into a vein. We have a registered nurse who's very experienced in IV, in finding a vein, and she does very, very well. But infusion means it has to be into a vein. And as I said earlier, there are lots of products out there that are oral product, but the disadvantage is it doesn't absorb very well. When it goes into your vein, it's absorbed right straight into your system.
And that's what I'm doing. And by the way, you mentioned Grace, your nurse. She is phenomenal. And yeah, she hits it 99.9% of the time. And I don't feel a thing.
Dr. Cole, wanted to ask you, you are obviously in North Dallas. You're up on Trinity Mills. But we've got listeners that are literally all over the country, South Texas and our No Bull Network friends, California and our TV friends. But because of Facebook, because of YouTube, we're going out all over. We even joke that we've got some aliens from Mars that are picking up the channel and really getting a lot of good out of it. So to get away from the silliness, but the serious question is, how would somebody, I'm going to assume there are a lot of others like you that practice this type of medicine, and I may not be saying that right, so correct me if I'm wrong. But is there a network around the country, if you're in Jackson Hole, Wyoming, or if you're in Norfolk, Virginia, how would one find somebody who does what you do, short of coming and hanging out with us in DFW?
I heard that the Chinese balloon was picking up your show.
Oh, really? Yeah. Uh-huh.
Those son of a guns, they finally did something right.
There is a source. There's the academy that teaches us all about chelation is called the American College for the Advancement of Medicine, ACAM. If you put ACAM into your browser, there are a few other ACAMs. So it has to be the American College for the Advancement of Medicine. Go to that site. They have a find a doctor source. And you just put in your zip code and they'll tell you where somebody is.
Okay, let's do that again. American College of Advanced Medicine. Is that correct?
American College for the Advancement of Medicine, ACAM.
Okay, there we go. We've thrown the site up.
Yeah, we've got it up.
Good, great.
And therefore, you can go there and find a doctor. You're Northern California.
Yeah, right there on the right side. Find a practitioner.
That's what you need. And this is important. Now, let's go back, because I think an important thing is all about our health. Nobody gets out of this life alive. We all are going to go.
Thanks for that.
But getting in your best, and when you get older, things like diabetes, heart, arthritis, other problems, inflammation. Arthritis is a form of inflammation.
Yes,
all of these things could be treated, not necessarily cured, but treated with these various therapies, like we're talking about the cancer or the diabetes and all that. And so you need to know, because what you don't know can kill you, correct?
Yes, sir.
And here in Dallas, you take walk-in customers. You're welcome to come on in. Also, I keep saying this, you're a licensed pilot, and a pretty darn good one from what I figured out. I need to take you up.
Fun flying, Jim.
Oh, yeah. I tell you what, I can't wait to take you up in the Grumman. You're going to love that little plane. Now, can you tell me a story? You told a story about the lady who came in with a cancer in B17. Can you relate maybe a little, without saying the names more specifically, maybe somebody with the diabetes or someone with another malady that this improved their life?
Well, we have a couple of patients that I can think of right offhand that have had sores come up on their legs, open areas. When you don't have good circulation, your skin all over your body, your skin doesn't have circulation either, and so it fades away. It breaks down. And so what happens with diabetes, when you lose the circulation to a particular area, the skin breaks down and opens up. And on several different occasions, but two people I can think of right away that have barely controlled diabetes. So let me digress there a little bit too. Most of these people, I don't take care of their diabetes. Most of our patients have 4 or 5 other doctors. We treat the complications of what's happened. So somebody else is taking care of their diabetes, but they come in with these open sores on their legs, and we treat them with chelation, and it opens up the circulation and heals those ulcers on their legs. And it works very, very well. We have a couple of people right now that are treating for that.
There's a patient that comes in on the same days that I do from Canton. She comes from Canton every day, and because she's had major heart issues, she's being treated with a chelation to improve her coronary situation.
And we are, by the way, talking about Canton, Texas, not Canton, home of the NFL Hall of Fame.
Right. Just that's a
making
long,
sure that would be a long drive.
Real long drive, you know. That's
East Texas.
I'm sorry, Dr.
East
Cole.
Texas.
My job is to provide the humor in the show, and I gotta confess, you're making it a little tough. Because this is not, I mean, we're joking about this, but this is not, as I said before, it's not a joking matter. And guys, get checked. Get your annual physicals. Get it done.
Well, that's why I went to Dr.
Let me tell you a little. If you have 30 seconds, let me tell you about a diabetes story. This is when I was a resident many, many years ago. Residents would go up and check on patients before their surgeries. The treating doctor, the supervising doctor, would put them in the hospital. Well, one day I went up to see a man who was 80 years old, tall, slim farmer, worked outside all his life, perfectly healthy all his life, until his big toe turned black. And he got diabetes at age 80. It just came upon him somehow. So we amputated his toe. And now this is back in the days 40 years ago when you could keep people in the hospital. You couldn't do this story today. It wouldn't work today. So we amputated his toe. Well, it didn't heal. So we did, as Jim said, a mid-foot amputation. That didn't heal. So we did a below-knee amputation. That healed. He went home. And so about 6 months later, I saw his name on the schedule for an above-knee amputation. It had gone bad further up. And so I went up to see him the night before, and he had an audience. That's the key to this story. He had an audience. The medical students were in his room doing his history and physical. And so I walked into the room, and he looked up at me, and he said, "You see that guy?" He says, "I hate that guy. Every time I see him, my leg gets shorter."
Well, that's what we want to prevent. And so that's why I'm telling you, I go to Cole Wellness Center. George Cole is a great friend of mine. It's important that you get well. We've put up the Cole Wellness Center on our Facebook, on our YouTube. The telephone number is 972-851-0111. This is the Veterans Impact Show, and we're here to talk about what great veterans do to continue the mission. And George Cole, U.S. Air Force, U.S. Army, doctor, continuing the mission to take care of our civilian and military community. I want to tell you, great man. Again, go look up Cole Wellness Center. We'll be right back after these words from all of our partners. This is the Veterans Impact Show. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Well, being a Navy veteran, I'm about to bring this program back into the dock. And thank you for being on board. And thank you, Nathaniel, for putting up the ready room. It takes me way back. Chuck, you as well on the Midway.
Oh, yeah. I spent a lot of time in ready rooms. Ours wasn't that pretty.
No. Well, it was the Marines. Everything was sort of drab. Olive. I'm sorry. All right. We have introduced Dr. Cole, Dr. George Cole, with the Cole Wellness Center here in Dallas. And what he has talked about is unique therapies that may not cure, but will really prolong life and give you a better quality of life. Wouldn't you say, George, is a good way to put it that way?
Yes, sir. That's right.
Okay, and we want you to go to Cole Wellness Center. Their telephone number is 972-851-0111. The reason I'm putting that out is because they're doing a great job to help me, because I've been diagnosed with very early stages of prostate cancer. This is something that's curable. This is something that's workable, and I'm using immunization therapy, and my urologist absolutely said, "This is great. I can't wait to see the results, and I think you're doing the right thing." That basically tells you medicine is changing. This medicine has been around for 75 plus years. It was chelation is one of the things for diabetics. What we're talking about with the B17 and the experience Dr. Cole has had and the experience that I'm having. Diane has a really good friend who had brain cancer and breast cancer, Diane, is that correct? Yes. Stage 4. And I think they basically said, turn out the lights, the party's over, get your affairs in order.
If you're going to do that, you have to sing it like Dandy Don did.
Okay, but here's what she did. She went to a clinic in Tijuana, and I don't know the name of it, but they were using the B17 and the vitamin C and going to a healthier diet, a vegetarian diet, an exercise program. She is in total remission. You wouldn't even know she had cancer from being told it's over. This is important that we take a look at this. And I know I would probably make a bunch of doctors real unhappy and them scream at me. It hadn't been the first time. But there are alternatives. Everybody's body is different. It may not work as well. It may work fantastic. but you've got to do a better job of healing your body and enabling your body to be inflammation free. Use your body's immune system. And I think that's important. Dr. Cole, I got to tell you, I really appreciate what you guys are doing for me, but what you're doing for the other people that I meet in your clinic. I've gotten to meet a lot of really nice folks.
Well, I don't mean this to sound disingenuous, but it's honestly the best thing I've ever done in medicine because everybody gets better. I don't mean that as a guarantee for anybody, but I love that part of the practice because everybody gets better, and it makes me feel good.
Better. Dr. Cole, because you use your veterans capabilities to go to medical school and you went to the Army to do your residence, what would you say to a young man or woman who's graduating from high school or graduating from college and wants to get a start in life, but they don't know what they want to do or where they want to go? What would you say about, hey, take a look at the military? I did it. You spent, I believe you said 13 years.
I would highly recommend going into the military. Highly recommend it. I wish we still had involuntary medical service or military service. I think everybody should go.
I do too, because it's the best thing. I was a student at SMU, did not do well, went into the Navy, and I was a straight A student from then on. It changed me.
General McChrystal talked about earning your citizenship, and before Jim brings us into the dock, as he likes to say, if you're listening, we ask you to follow us on Facebook, hit the subscribe button on YouTube. It doesn't cost anything. It doesn't really do anything, but it looks good for us, and we're trying to build up that audience. As you can see, we have dramatically, thanks to Nathaniel Smith and Ascend podcast, we've dramatically improved the visual aspects of the show. We were having some challenges with the way everything was coming in. I'm getting the signal from Diane to hurry up. So, Jim,
all right, I tell you what, Dr. Cole, we close every program with a prayer. So I wish to say, Lord God, we thank you for veterans and men like Dr. George Cole who do so much to take care of our community's health and to help people. Thank you in putting a hedge of protection and protecting our active duty military, our first responders around the world. In your holy name, we say thank you, God, for all you do for us. Amen. Dr. Cole, I want to say a special thank you for coming on board as we will chronicle my treatment and what we're doing and show people there is a better way and it may work for you. This is the Veterans Impact Show. We'll be back next week for you.